name is Mallory Harris. I'm a PhD candidate in the Department of Biology at Stanford, and today I'll be sharing some of my work on trying to understand the links between climate change and human health. Specifically, I'm focused on quantifying how much Cyclone Yaku increased cases of the mosquito-borne disease dengue in Peru and Ecuador last year. Climate change is making extreme weather like Cyclone Yaku more likely to happen and more intense when it does happen. This was a tropical cyclone that happened last March and primarily affected the 5 coastal regions in Peru and Ecuador outlined in black here. And you can see they tend to have warmer, drier climate. The theory is that this type of anomalous precipitation can promote dengue transmission by creating new breeding habitat for mosquitoes through flooding, destroying infrastructure, and hindering vector control efforts. Fair enough, after the cyclone, there was a huge spike in cases exceeding historical levels in many of the affected regions that are shown in color. In total, around 400 people in Peru died over the course of the outbreak. But to tease apart how much of this spike is attributable to the cyclone, we need to compare those provinces to our control pool of places that weren't affected by the cyclone in black. To do this, we used a generalized synthetic control, and I'll give you an example of how it works, focusing on Tumbes, Peru, which was affected by the cyclone. We fit a model to account for temperature, precipitation, and other potential confounders that vary over time, but we can't observe directly. So things like immune dynamics, migration. Then you can see here that the red line, which is our model, does a pretty good job at matching actual cases over time in black. We can use our model to estimate what cases would have been like in Tumbes without the cyclone. And the difference between these two lines then tells us about the effect of the cyclone. I'll note that this is on a log scale. Here I'm showing the results of this analysis for all 5 regions. So we have a monthly estimate of the factor by which the cyclone increased cases. And you can see this large significant increase across the Peruvian departments. In June and July, it was up to a factor of about 100. Whereas in the Ecuadorian provinces, you see a much smaller effect of the cyclone. My next step is to use more precise district-level data pictured here. I'm also planning to examine how underlying conditions like water access and housing quality may change the size of the cyclone's impact. The answer could help inform adaptation efforts so that regions can increase their resilience to these extreme events in the face of climate change. With that, I'd like to thank my collaborators on the project listed here and my funders. And I want to give a big thanks to the entire ARCS community for their support for my research. I'm really looking forward to the symposium.